Hi, I'm Nurse Lucy, and today I will be doing a wellness head-to-toe physical on a 23-year-old male. Hi, I'm Nurse Lucy, and today I'm going to be doing a head-to-toe wellness physical on you.
Hi, Nurse Lucy.
Hello, nice to meet you.
Nice to meet you too.
Today I'm going to be conducting a head-to-toe physical, and I'd like to start off with doing your assessment of your head and your face. You would don gloves because we're going to be touching the patient's scalp. So we would be inspecting the skin, checking for symmetry. So we're going to be inspecting the eyes and the ears for symmetry. We're going to be inspecting the skull configuration. We'll be touching for any bumps. We're checking for pediculosis, head lice. Since he does have a beard, we're going to go ahead and check his beard as well. We're going to be palpating his facial bones. Any pain?
No.
Very good. We're going to be palpating his temporomandibular joint. Go ahead and open your mouth. Very good. You're assessing for any clicking. Very good. Does this hurt?
No.
Any pain?
No.
Very good. We're also going to be inspecting his mouth. Okay, so go ahead and open your mouth. Very good. Close your mouth. I'd like for you to go ahead and clench your teeth. I'd like for you to squeeze your eyes tight. I'd like for you to wrinkle your forehead. Very good. I'd like for you to stick out your tongue. Very good. I'd like for you to go ahead and puff your cheeks. Very good. And I'm checking cranial nerves 5 and 7 for the test light test sensation. Next, I'm going to be examining the eyes. We're going to be examining the external examination. I'm going to inspect the eyelids and the eyelashes. I'm also going to check the papal folds of the eyes. I'm checking for alignment of the eyes. I'm also inspecting the sclera. Look up. I'm also looking to see if it's like a white color, and I'm also checking for the conjunctiva. It has to be white, and also the iris. And I'm also going to palpate the lacrimal apparatus. Very good. And then at this time, I would also be checking for near vision using the Rosenbaum chart. I'm also going to be checking his eye function. I'm going to be testing his papillary response to light accommodation. Okay, I'm going to check your eyes coming in with the light. Okay. I'm checking his pupils. Very good. Now I'm also going to check for accommodation. So you hold it about 12 feet. Very good. And I want you to follow this. Very good. I'm also going to check for extraocular movement. I'm going to check cranial nerve 3, the ocumotor. And I'm also going to check cranial nerve 4, the trochanter. And I'm also going to be checking cranial nerve 6 for the adducens. Okay, so I'm going to be checking for the 6 cardinal fields of gaze. Okay, so I want you to go ahead and follow this, sir. Next, I'm going to be inspecting his ears. I'll be checking for alignment and placement. I'm going to inspect the surface of the ears. I'm going to inspect the auricle of the ears. I'm also going to be conducting the whisper test, but I'd also would check his tympanic membrane, and what I would be checking for to see if the tympanic membrane is visible, if it's intact. I'd also check for cerumen. I'd also check for the cone of light. The right ear has the reflection at 5 o'clock and the left ear has the reflection at 7 o'clock. So I'm going to do the whisper test. I'd like for you to cover your ear with this one. Okay, and I'm going to come behind you and I'm going to repeat something and you say it out loud.
A, B.
Good.
Apples, oranges.
Very good. Now I'm also going to inspect the nose. I'm going to inspect the structure of the nose. I'm going to determine if it's patent, the patency. So I'd like for you to go ahead and press this side of your nose. Blow out. Now this one. Very good. So the nostrils are patent. His septum is midline. Okay. I'm also going to be inspecting the nostrils. I'm now going to be checking the mouth and the pharynx. I'm going to be inspecting the lips. I'm going to be inspecting the gums, the oral mucosa. Very good. Stick out your tongue. I'm going to be checking the tongue for the color of the tongue, also for mouth odor, cavities. I'm checking cranial nerve. Check for gag reflex, cranial nerve 12. Very good, that's intact. I'd also be performing the test and the smell, checking for the cranial nerves. Also, his vagus nerve is intact because he can speak and he can swallow for me. Thank you. Next, I would be checking the neck. I would be inspecting for symmetry. I'd also be checking his thyroid. I'd do it from behind and I would palpate. Okay. I'd also be checking his shoulder, neck strength. Go ahead and do a shoulder shrug. Checking cranial nerve 9. Very good. I would palpate his carotid artery bilaterally. I'd also check to see the position of the trachea to see if it's midline. And I'd also be palpating his thyroid. And then I would palpate his lymph nodes. I'd start off with the pre-auricular, post-auricular, occipital, tonsillar, submaxillary, submental, supracervical, posterior, deep cervical, supraclavicular, and inferior clavicula. I'd also be auscultating his carotid arteries. Be checking for bruits. Next, I'll be doing my assessment on the upper extremities. I'm gonna inspect the skin characteristics. I'm gonna be inspecting the nails. I'm gonna be looking for fungus. Okay, I'm gonna be checking for skin turgor. I'm also gonna be checking to see his range of motion in his fingers. I'm going to be checking to see if he's got signs like of arthritis, osteoarthritis, rheumatoid arthritis. Usually they have nodes. Very good. I'm also going to be checking his pulses. Radial pulse, Very good. I'll also be checking his brachial pulses. Very good. Now I'm going to be inspecting his back and posterior chest. I'm checking for symmetry to see if he's got any abnormalities of the chest. I'm also going to be inspecting the symmetry of the shoulders, and he would be wearing a gown and he wouldn't be wearing clothing, so it would be better to be able to inspect. And then I'm also going to palpate the costal vertebral angle. Next I would be checking for his lungs. I would inspect for his respiration. I would be checking for excursion. I would be checking for depth, rhythm, his breathing pattern. I would palpate for tactile fremitus. He would repeat saying 99 to check resonance. I would auscultate. I would check. Have him inhale, exhale, inhale, exhale. I would check the upper, the middle, and the lower lobes of the lungs. I would also check symmetry. Sit up straight, sir. Thank you. For thoracic symmetry. I would also percuss for diaphragmatic expansion, and then I would also assess for any adventitious breath sounds. Next, I would be assessing the anterior chest and the heart. The patient would not have a t-shirt. I would be able to inspect his chest. I would be able to inspect the symmetry of his chest and the skin and the color. I would be assessing heart sounds. I would check for the aortic valve, and the aortic valve, you can auscultate it on the right intercostal space. I would move over to the left intercostal space to auscultate the pulmonic valve, and then I would go down to the third intercostal space to assess the Erb's point, which is the middle point, and then I would go down to the fourth intercostal space to auscultate the tricuspid valve, and then I would go mid-clavicular to the fifth intercostal space to auscultate the mitral valve, and I would be assessing heart sounds. I would be looking out for any murmurs and any abnormal heart sounds. My patient is a male, so I would be inspecting his chest. Again, he would be not wearing clothing. I would assess again the skin of the patient. I would be assessing his nipples for any drainage. I would also be palpating his axillary nodes. I would be palpating the supraclavicular, inferior clavicular nodes. I would also have him at a 45-degree angle, and I would be assessing for jugular vein distension. Next, I'm going to be assessing the patient's abdomen. Again, the patient wouldn't be wearing clothes. He would have a drape and he would have a gown. So I would inspect, again, the skin characteristics of his abdomen. I would auscultate all four quadrants, starting clockwise with the lower right side moving up to the right upper, and then crossing over to the left upper and the left lower. Then I would percuss all four quadrants. Then I would do light palpation, about 2 centimeters deep, and then I would do deep palpation. And then I would check for the liver enlargement, for any kind of enlargement like hepatomegaly. Next, I'm going to be assessing the patient's legs and feet. I will be checking for skin color, We'll be checking to make sure that the hair is evenly distributed. When patients have peripheral artery disease, the shin will be shiny. There won't have any hair, and also DVTs for any swelling. I will check his toes. I will check his nails to see if the patient has any ingrown toenails, any fungus on the feet. I would be assessing his popliteal pulses behind the knee. I would be checking the dorsal pedalis pulses, and I would be checking the tibial pulses to see if they're equal. Next, I will be doing my neurological assessment on my male patient. I would be checking for test sensory function. First, I would be checking to see if it's dull or sharp, so go ahead and tell me if it's dull or sharp, okay?
Okay.
Close your eyes.
Dull. Sharp. Dull. Sharp. Dull. Sharp.
Very good. Next, I'm going to be checking for graphesthesia. Sir, I'm going to be writing something in the palm of your hand. Close your eyes and please tell me what it is.
R. 12.
Good. Okay, now I'm going to be testing your fine motor skills. I want you to go ahead and touch your nose with your fingertips, please. Okay, alternate with your thumbs. Very good, very good, very good, very good. Next, I'm going to be checking the patient's gait. Go ahead and stand up, please, sir. Very good. I want you to walk heel, toe, heel, toe. Very good. I want you to put your hands on your waist. Very good. And I want you to turn. Very good. Very good. Okay. Put your hands by your side, and I want you to lift one foot and close your eyes. Good. Good. I'd like to thank you for coming in and getting your wellness physical. I'd like to talk to you about wearing sunscreen. I did notice that your skin is a little bit red, so I would like to give you some literature on wearing sunscreen when you're out. Maybe wearing long sleeves, maybe wearing a baseball cap is very important. And also, I'd like for you to go ahead and wear your seatbelt when you're operating a vehicle, when you get in your car, when you're a passenger. Make sure to please wear your seatbelt, okay? Thank you very much for coming in for your wellness physical.
Thank
Good
you,
luck.
Nurse Lucy. Thank you.